So they just wait for people to come in. See, so we've got some 12 viewers. I was like trying to look for how many viewers there are. Welcome, welcome. We will give it a few minutes just so everyone can start joining as the numbers slowly go up. Brilliant. So got a few members slowly going up. So we will just make a start as we know that your time is precious. So welcome, official good afternoon and welcome to this webinar on how the NHS can leverage automation to improve workforce health. And today we will be going over the growing complexity within the NHS occupational health management. We will then be looking at, okay, well, about the complexities, how can automation? So we'll be looking at the power of automation, how that can help support. Then we'll be looking at customization for NHS needs and looking at things like governance. And then we'll open the floor up to you guys where you can leave some questions for us and we will help get back to you. So if we can do our introductions. So Sam, take it away.
Thanks, Hamson. Yeah, hi everyone. I'm Sam. I'm the head of product at Medibase. I've been with Medibase for just about 7 years now. Done a variety of different jobs while I've been here. I actually used to work in an occupational healthcare company myself as well, so have some background understanding of some of the challenges that people in the industry face. And yeah, really looking forward to talking today about occupational health processes and how automation can help.
Brilliant. Thanks, Sam. And now just to introduce myself, my name is Tamsin. I am the application training manager here at Medibase. I have a very extensive background in computer science and education. However, since starting Medibase, I've been working a lot with occupational health clients. So I've gained quite a wealth of knowledge from basically what clients want, how they can improve, and especially this automation piece. So let's take it away. Over to you, Sam.
Thanks. Yeah, just a little bit of brief background about who we are, who Medibase are. Medibase has been operating for 20 years. We work across a wide variety of healthcare domains, but have a lot of experience in the occupational healthcare market. We're based in the UK, so most of our team are in London and elsewhere in the UK, and have done a lot of work with OH providers and internal teams in that territory. But we also have teams kind of globally. So we've got folks over in the US and in Canada, we have a team in Australia, and we have customers kind of across the globe. So we've seen a lot of different styles of implementation of occupational health services and have sort of taken lessons learned from all of those regions and applying them and helping all of our clients work with those best practices. And just a little bit of some numbers to demonstrate what Medibase does. So over that 20-year history, we've allowed our customers to conduct more than 17 million medical appointments. We've processed £4 billion in transactions. We've currently got just over 8 million active patients in the system, and there are many, many millions of medical history records. So there is a lot of data in the system, lots of customers trusting us with their really sensitive data, and that's really, really good thing to see.
Absolutely. So we do want to invite you, want to make this as interactive as possible. And we have a Slido where I'll be asking you some questions. If you can, if you're on a computer, please access slido.com and then put in the access code, which you'll see on there, which is 3600279. Or if you have your phone handy and you're on a computer screen, if you scan the QR code, it'll take you straight to there. We'll leave the screen up just so you can all get joining, and it'll be just fantastic just to gain some insight as to what your current challenges, etc. are. And so, our first question: what is your biggest challenge in managing occupational health workflows? Do you find, well, I mean, at the moment it's coming through, it's managing high volumes and complexity. We're seeing some movement on tracking tasks and deadlines, but currently compliance and governance. There's been no votes on that one yet, and we do have open responses available. But
I
even just
think
looking
that
at the results that are coming in, it makes sense, doesn't it, Sam?
Yeah, definitely. I mean, that high volume combined with complexity, I think, is going to be a theme of today. But they are all sort of tied together as well. The high volume nature of the work means that the other concerns are sort of worsened because you've just got to do more and more of it.
Absolutely. So yeah, that managing high volumes is still staying number one. Our second question that we pose to you: how familiar are you with using automation tools in your occupational health processes? Do you even use any at the moment? Okay, 50-50 split so far. Let's see how long that stays. So we see a large proportion spent on those manual processes, and then some not at all familiar. And please be honest, we can't see your names here. We do like honesty. Fantastic. Now, if we push to our next question, because we can see that's somewhat familiar, but not all. Now, what area would you most like to improve through automation? Is it appointment and referral management? Is it more so about the tracking and compliance? Is it escalations for tasks and tracking that overdue and for service level agreements? Or is it the collaboration between the employee and the clinician? I'm liking this. Brilliant. This has given us some fantastic insight and actually leads us very well onto what we'll be further discussing today.
Yeah, definitely.
Any more points from you, Sam, before we begin?
No, I mean, I think, I was sort of expecting that appointment and referral management piece to be the most common sort of target for automation. That's where a lot of work exists, and my experience is it tends to be a very manual process before you start implementing some automation there, and lots of human intervention required. So I think that makes sense.
Exactly. So let's start where we started with our first question: the growing complexity within the NHS, specifically occupational health. Now, managing occupational health in the NHS has become increasingly complex, especially with the growing administrative demands. Sam, for you, what are the key pain points you've observed, especially with your background in occupational health and working with clients, and when it comes to these manual processes?
Yeah, I think there are two things that sprung to mind when we were talking about this question initially, and the first one is around the process of getting referrals into the service. And so often you find that those referrals arrive incomplete. A piece of paper landed in someone's in tray, or an email arriving into the inbox saying, please see Sam for occupational health, and not having that full picture of what the requirement actually is, I think, is a really big pain point. And then that just makes that whole process needlessly labor intensive. You've got a lot of back and forth between the OH team and the referring manager or the employee directly, leads to a much more drawn out process than it necessarily needs to be. And I think that the second point that came to mind was that sort of if that's the top of the process, then the tail of the process around getting the sharing of the report to the employee and then to their manager, and that being a manual process again, there's a lot of touch points required there, and that means that that process just becomes needlessly complex. And this all sort of ties into when a case ends up in front of a clinician, they don't have a full picture of what they're actually trying to achieve with the case. And then when they end their appointment, trying to get that information shared back out again. Again, it's just that the number of touch points increases massively. It's a really inefficient process, and that kind of, it becomes risky just by being inefficient. And particularly in these I think we sort of talked already about the fact that this is a high volume service. Having to have all of those touch points happen for a high volume service is just such a pain, and means people are doing jobs that aren't harnessing their skills correctly.
Exactly. And even just a statistic that we're seeing on the screen right now, nearly a quarter of patient cases have either incorrect or incomplete. So then that chases up to more time being spent on chasing these up, when initially, if it could have been captured in the first instance and it being managed, that could be brought right down.
Yeah, and it always just feels so unnecessary when that happens, and that just leads to frustration on everyone's part.
Mhm.
It's not just frustration on the administration and clinician teams, which is obviously super important, but it also ends up with a frustrated employee, a frustrated
Mhm.
manager, because the process doesn't seem to be doing what it was designed to do.
Exactly that. Exactly that. So, do you think that with the increasing complexity within just the OH field in general, it's also leading to more risks for compliance and, as we already discussed, potential errors in just employee management? What do you find is the most complex part?
Yeah, well, I mean, I guess the first answer is yes, absolutely. Um, when you're increasing both volume and complexity and managing through that through a manual process that needs lots of human decision making, that just increases risk sort of exponentially, and that is not obviously not great. I think one of the most complex parts there is trying to balance that volume and that complexity with increasingly stringent service level objectives, compliance requirements. All of these sort of um, push factors are all pushing in different directions, particularly when you're managing it through a manual process. And so trying to make sure that your compliance and governance standards stay high while increasing the volume of this complex work is really, really painful, and actually can be really hard to start breaking apart. And finding that first place to start making improvements can be really challenging.
Yeah, exactly that. I mean, back in 2021, the NHS did an operational challenges survey. And even back then, 3 years ago, it was found that 63% of NHS managers cite compliance as one of their top operational challenges because of the increased case volumes and complex processes. So back in 2021, still was a massive issue, and we can only imagine now if no automation processes have been put in place. So that leads me on to my second question for you, Sam. So with these challenges that we've discussed, um, we've mentioned some of these, but what other compliance risks or inefficiencies would or do NHS teams face without automation?
Yeah, well, I think there are a number of areas where we can start breaking this problem apart and start increasing the efficiency while also reducing risk. This kind of you can pick any one part of this process to start tackling. I think some of the things that came to mind initially were uh, tying your process for appointment booking through to billing to a set of rules that can be understood and served automatically to relevant users by a computer, right? That kind of process of understanding what a contract or what a service level objective means for a particular team, and how that should interact with an appointment booking process is a really, really powerful part of the process to start automating. You end up solving a large number of those unnecessary human touch points by tackling that. But even really simple things like allowing your clinician schedules to dictate some of the restrictions or requirements that bookings should meet in order to get into those diaries or those schedules means that you can start managing this complex service with its high workload with a bit more automation. Building in those sort of baseline rules really is a good starting point for starting to leverage the efficiency gain that you get through automation. And then, one of the perhaps trickier ones to start with if you don't have a sense of automation in place, but perhaps one of the more important ones to be thinking about is automating those compliance critical activities, such as case management report release. If you can get the automation of that right, then you're ticking off all of the boxes, all of the pain points that we've talked about so far, of it being a high volume workload with lots of human touch points in an increasingly compliance aware environment. And that can increase not just your compliance, but also the sort of satisfaction of all of the teams involved, administrative and clinical definitely, but also the employee and their manager, giving them a clear view of what's going to happen and when, I think is a really, really good candidate for an area of the service to look at some automation around.
Absolutely. I mean, even like just doing research, we found that automated systems can reduce like up to 80% of admin errors, which then obviously will translate to 20 hours a week have now been freed up to allow clinicians to actually do what their skill set's for rather than spending chasing these manual tasks. So the power of automation. So we talked about the growing complexity, what these pain points are, but what about automation? What is the power of it? Sam, so with automation, how can this assist the NHS occupational health teams with processes such as billing, diary management, availability? So you've talked about them, but do we have any more that we could build upon?
Yeah, I mean, I think there's a number of areas that you can look at here. This is an example of a sort of case management workflow that a team might want to go through, and you can see some of the areas here where that automation can start improving the service. Referral creation through triage, SLA management being managed automatically, again, is a really important one. One of the things that a lot of the clients that we speak to spend a large amount of time doing manually is just communication. Reminders about things needing to be due, appointments needing to be booked, even just appointment reminders to employees, and managing the communication automatically is just a massive time saver. And yeah, we sort of mentioned some of these other areas around allowing your contract management to influence the booking process automatically. The same thing with clinician availability, making those schedules a bit smarter and putting a bit of automation into them. And yeah, I think I also mentioned that the report release process being automated is just so critical from all of the different points of view.
Absolutely. And the future role of automation in the NHS, and specifically, was always talking about occupational health here. In your experience, which areas do you think that the NHS should prioritize in terms of this digital transformation?
I mean, that's a really, really good, really big question. I think that if we want to think about it holistically, first of all, I would start by saying, let's look at the parts of the process where we don't absolutely need a human to be involved in the process and target that for automation. So, think about what tasks can happen automatically. And I think that the most obvious example here is communication by, SMS or email around really simple things like your appointment confirmations or reminders, reminders to complete a questionnaire. These things that so many teams are managing manually can be automated really simply and very easily, and I think can give you a massive time saving. And then I think you also want to look at what tasks need to be completed, but don't necessarily need to be completed manually by the OH team. How can you involve the employee or the manager more in the process and give them a part of the work to do. So completing a questionnaire digitally with automated reminders and follow-ups, doing digital health screening, and having that employee more involved in the process can again free up time for the internal OH teams to be doing more of those human critical tasks. And I think it's also really important here to be very aware of what parts of the process you definitely need people involved in, because technology is great, but it can also get in the way. And being really aware of where your team are best utilized and best spending their time is going to be really important.
Absolutely. And just off the back of your second point about how can we get employees involved, engagement is a massive thing when it comes to anything. Past experience being an educator, having someone engaged makes it a much better experience for everyone, for not only the
For sure.
clinician, but for the employee. They feel listened to and valued, and then again satisfaction rates will increase. So I think that's fantastic, just to break it down, because it's always hard to know where to start. Well, we want to do automation, but what can it do, and make in that opinion. Fantastic.
Yeah, and actually, Michael in the chat's got a really good
Mhm.
point around automation, and it's about automating recalls. And you very rightly make the point that recall times shouldn't be the same for every different type of case, or even if we think of within a case type, if we're talking about health surveillance, not all of the recalls should be the same for every instance of that case type. And I think there you want to look at how you can develop your clinical governance structure into a set of rules that follows the base case for your recall management. So let's say a HAVS one has a yearly recall, for instance, but then and have that automation as a starting point, but also allow clinical intervention to adjust or modify that. So if you think about an employee's health surveillance requirements as not a series of single events, but as a journey that they need to go on from, a yearly recall journey, let's say, and then map out what the clinical governance framework says should be the base case, then that's a really good starting point. And look to find or build a system that can trigger work events and involve all of the right people in decision making to augment that automation. So automation is the base case, with clinical intervention still possible where necessary.
Absolutely. And this is something that a lot of clients have been working on, and I've been supporting with at the moment, is they have that base level of every single year they'll have an audiology appointment. And then they say, well, what if someone fails their audiology appointment? Well, what we can do, the clinician can step in and say, well, actually, I want to see them again in 3 months' time. I don't want to have to wait that year. And also, I don't want to have to manually chase it up. The system is able to pick that up, and the relevant people are notified. So there's a lot of flexibility there. And again, linking in what you said before, Sam, where we can have tasks happen automatically, but there's still stages in which it has that human intervention, because as humans, you are skilled, you know exactly when that intervention is needed. Brilliant. Thanks for that, Michael. So, my next question to you, Sam. How does the Medibase pathways feature? So we're talking about customization now for NHS needs. So we've talked about automation, but what about customization? What about our unique workflows, and what about our branding, etc.? How can Medibase pathways feature? And I'll leave you to explain about what pathways are, Sam. How can these support the NHS OH teams in managing both internal staff, and I know they do have some external clients, particularly in the triage to clearance process or the vaccination management pathways?
Yeah, I mean, I think this is okay. Let me start with what is Pathways? What we're talking about here. Pathways is a workflow management tool set, and it's a generic feature of our system that allows customers to define a business process and then have the software prompt their users to follow that business process and support them in following that business process. And that can really help in a number of ways, talking about those workflows that you mentioned. The first one is very simple to say, but I think very powerful if you get it right. And it's about putting the right piece of work in front of the right person at the right time. So, back to Michael's question around recalls, if we think about a health surveillance pathway that we might want an employee to go on, that could be triggered based on an appointment discharge or a recall becoming due, for instance. And that could say, okay, the next task that needs to happen based on the business process that I've configured is we send an automated reminder to the employee to remind them that the recall's due. And then we give our administration team a task to make a booking. And we want to allow them to get in contact with that employee. We'll present their contact information to them. Once that appointment's been booked, we might send that employee a questionnaire to complete, which they can do online. And then, that all ties together into this one journey that the employee is going to go on. And that really allows those workflows to make to allow your users to make sure that they follow those workflows correctly. And we can involve the administration team, the clinical team, and also, as we've mentioned a couple of times already, involve the employee directly in the process and give them a bit of ownership over it, to help make sure everyone's aware of what's going on. I think the other thing that is really critical, particularly around those triage workflows, vaccine management workflows, is that timing is so often so crucial there. It's not just do this job, but it's do this job within this time frame. And so being able to say, I need this appointment to be booked and I need it to be booked within the next 2 weeks. And if it looks like it's not going to be booked on time, we can do things like automatically escalate it to a more authorized group of users who should be aware of just the ones that are going to become overdue and be a bit more proactive around managing those potentially overdue workflows. That just means that you're getting ahead of the problem and you're not ending up with a massive backlog of overdue things that suddenly needs, all hands on deck to sort of solve the problem. Being more proactive around that and allowing automation to help you there really is very, very powerful.
Especially just off the back of that point with ownership, it's knowing who is in charge at what stage. Like if it's at this stage, okay, I know I'm in charge. Who do I go to next? Especially as OH grows, as the needs grow, the organization will grow. So knowing who is the correct port of call can handle it and manage that. And then it comes back in to workload management. So it's all holistically linked at the end of the day. Fantastic, Sam. So this takes me on to my last question for you. You've batted them off pretty well. Very good answers, including Michael. Thank you for your questions. So with automation in general, so let's talk about it more holistically, that key term. How does automation make sure that no critical tasks or employee falls through the cracks, especially in such a complex environment? And then how can this help NHS OH teams maintain good governance, taking it back to the start, good governance and compliance standing?
Yeah, I think that actually the place to start here is not technology, and it's not even actually automation. It's about service design. It's about making sure that your service design and your business processes are good and correct. And if you build that as a good foundation, then you're going to be more effectively able to implement automation in those key areas that we were talking about. And if you have that good foundation, then technology can start supporting those well-designed services, so that technology intervenes when necessary, perhaps alerts users to the fact that something might be about to become overdue, for instance, and give that, again, that word holistic overview of what the workflow is, what's coming up, what's due now, and who's in charge of each of those steps. And that automation is really a supporting actor to a good service design. And then really critically, understanding that technology can get in the way. And if you try to automate too much, or if you try to automate too much too quickly,
Mhm.
particularly, you're going to end up with users not having the information they need to hand. And it's really important to bring everyone on this journey of automation together. It's not just about sticking some technology into a team and expecting it to magically solve the problems. You need to have a good understanding and a good solid base of what the service is meant to be doing, making sure everyone's on the same page with that, then choosing the right target for automation as a starting point, and then slowly building out more and more over time. I think the sort of gently and softly approach definitely helps here. You don't want to go from 0 to 100 in the space of a week. And that means that uh, you can bring users on that journey with you, make sure everyone stays engaged, and make sure everyone is supportive of the overall goal. And that if you're in that scenario, then you're able to use that automation to increase all of those good things that we've been talking about, right? Increase your compliance, maintain good governance standing, and increase satisfaction as well of all of the relevant parties. Um, but just to re-emphasize, I guess, really start without the technology and start with the service design and think about what you want to be doing and when, and then building on that.
Absolutely. Technology should be complementing, not fully replacing. As you mentioned in the previous slide, clinicians still need to be able to make that decision at the end of the day. And that
Definitely.
is,
There's
yeah.
so many parts of this process that people are so critical to. And I think that the ideal role of automation is about freeing their time up to do more of those things rather than trying to leave them with no work to do. Like that's not
Mhm,
what we're trying to do here. We're trying to say these are the bits that you're critical in, and you should be spending free to spend your time doing those things and doing all of the things that humans are amazing at, and not spending your time manually sending email confirmations to employees 1,000 times a week, for
mhm.
instance.
Exactly that. That is all my questions for you, Sam. So I really appreciate it. We do in the comments, we have some articles that we've sent out just to show you and explain a little bit more about the case management workflow that we had in the previous slide, pre-placement questionnaires when you start a questionnaires, and how that works within the system, and then also health surveillance. So Michael, that links back to your point. How is health surveillance? And it's all mapped out in those articles, and we will also share them with you um, after you've attended the webinar. Now, what's left for us to do is to open the floor for your questions. So please leave us some questions in the comments. I can see Charles is going away with some questions. Fantastic. And we will go through them and start to answer them. So please don't be afraid, just ask those questions. So, Charles Hamilton. Our trust spends an excessive amount of time manually counting and billing our external customers as our current system doesn't have a billing system. We're thinking about investing in a new financial system to manage invoices. Can Medibase integrate with financial systems? Sam, I'll leave this to you.
Yes, definitely. So tackle that from a couple of different points of view. The first one is that I don't want to be too promotional about Metabase, but I suppose in this case I'm going to. Metabase can do the invoice generation piece for you based on those rules, those contractual rules that we were talking about, and we can also integrate with financial systems either via a messaging interface or through a native integration with a couple of different financial applications. So we can do the invoice generation piece automatically, making sure we're following those contractual rules, and then send the invoice to the place it needs to go so that the actual billing process can happen. Some teams actually manage their entire billing process in Metabase, but larger teams tend to have an external EPR that they work with, and we'll do integrations with them in those cases.
Absolutely. It's a very smart system. We have another question from Will North. I just put that on the screen. So as you know, NHS uses ESR, sorry, as an employee record hub. It's much more likely that employees' records are most up to date there, such as leaver, starters, role update. How can the automation and pathways link in with this ESR to support this?
Yeah, it's a really good question. So those details about the employee that you mentioned, Will, are really important for managing the workflow. You know, what is the employee's job title? Does that put them into a specific risk exposure group, for instance? And the interface between ESR and whatever system it's talking about, making sure that the record in Metabase is up to date, and definitely viewing ESR as the boss in terms of what the
Mhm.
employee records look like from a demographic point of view, means that the right information can be in Metabase at that point, and then we can start the right workflow for the employee. So, if they get marked as a new joiner, does that mean we need to start a new starter health questionnaire process for them? If they get marked as being in a particular job title, does that mean we need to look at putting them on a particular health surveillance pathway? It definitely links back into that service design piece. We need to know what the trigger points are for our processes to kick off. But once we know that information, then we can definitely build some automation around it to help manage the process.
Absolutely. Do we have any more questions? Those are some fantastic questions that have come
Mm,
through.
yeah,
Um,
super interesting.
Very good. Do we have any more questions that are coming through? I'll give it a few more seconds just to give some thinking time.
I think the questions that we've had already, just to sort of go back over them, really actually touch on a lot of the complexity that NHS OH teams are facing. Is it's
Mhm.
not just clinical governance. Clinical governance is a really important part of it, but it's also this super connected service that is operating at high volume and expected to deal with changing requirements
Mm.
rapidly. And I think that that means, whatever system that you choose to run your OH service on, you need to make sure that it is adaptable as well. So it's not just here's the service, here's how it works. That this software is totally hard coded to your workflow, and we hope it doesn't change. I
Mhm.
think it's making sure that you can change the configuration of your software to match your business process, and not the other way around. It's quite rare that the right decision to make is let's change how our team operates because the software happens to work this way. Sometimes that is the right answer, but often it's not. And that's another point where just getting the balance right there is super important.
Exactly. And just to go back on Charles's point, as I mentioned at the start, internal and external customers, why should we have to have two systems to handle them both? Why can't we just have one? And the system takes that burden of remembering, oh, well, internal staff, they can have this. External, we charge them this at this when it's this clinician. I see a message from Zara. It's not a question, but it's a thank you. Interesting session. Again, it's all thinking about extending digitization. Absolutely. So that is everything from us today. So thank you all for joining. We really do appreciate your questions have been fantastic. And thank you to Sam for all your answers. They've been very thorough and hope
Thank you,
opened up
Tamsin, for the
some eyes.
questions.
I'm glad. And hopefully opened some eyes. And again, Zara getting thinking about digitization and how it can actually be a help rather than a hindrance. If you would like a personalized demonstration, please contact us. But also we will be sending some emails out that contain resources, videos, just to give you a little bit more about what Medibase can actually do when it comes to this automation and just supporting you. Brilliant. Thank you, everyone. And we'll hopefully see you all soon.
Thanks, everyone.
Bye.